So welcome everybody. Like I say, thank you very much for attending this webinar. I know it's a strange time at the moment with us all kind of working from home, doing a lot of video kind of work through the day. So to spend your time and your money this evening, I really am grateful for that. So welcome to the KSA Building Your Portfolio webinar. Like I say, I've run this webinar once before, but prior to that, I've got quite a lot of experience of actually assessing KSAs when I was the course director of the Nottingham CBT High Intensity programme. And I want to introduce you to a couple of people. I've already mentioned Jez already, but Jez is here, like I say, as my support, my technical support. I'm really grateful to him for joining us and helping me. And we've also got David Blant here, who is the current course director at Nottingham. So David not only marks these or assesses them regularly for people who are, applying to come on the course, he's also completed one himself. So he's got first-hand experience of how that was, and he's got loads of, tips and his own sort of experiences to share with you. So I'm going to hand you over to him so he can introduce himself properly. But thanks again, David, for joining us.
Yeah, no, it's an absolute pleasure to join you. I do apologise because I will be leaving at 6 o'clock, unfortunately, but I'm here for the first hour. So hopefully I'll be able to kind of have some input and answer any questions up until that point. I'll give you a little bit of my background. I've worked in mental health services in the Midlands, really. This is now for over 20 years, believe it or not. So within those roles, I've worked in secondary services with patients with psychosis, and I've worked in primary care, and it's mainly primary care that I've been doing talking therapy. So I was originally a PWP. So I don't know whether any of you guys are PWPs, but that's psychological wellbeing practitioner. And that was created as part of improving access to psychological therapies, or IACT. And I became a PWP back in 2011, 2012. And really, that's where I started to sort of learn and deliver CBT-based kind of approaches. And then I actually did the course in Nottingham when Helen was the programme lead. So it was Helen that would have marked my KSA back in the day and helped me get through that sort of process, really. And yeah, I'm sort of fortunate to be on the other side of that now, I suppose, and have the privilege of sort of supporting people through their CBT training, which I've literally just been doing today. So I've been doing sort of session on depression online today, so very similar to this. We're talking about activity scheduling and treatment for depression. So yeah, so it'll be a pleasure to kind of talk to you and hopefully give you a few pointers, really, in terms of sort of developing a KSA. So yeah.
Thank you very much. That's really great to have you and have somebody who has been through it and has got experience on both sides. So that's fantastic. So shall we start with the first slide then, please, Jess? Right, so I am aware of the time of day, and like I say, that we've all probably been rushing around, or even if we haven't, we've probably just been sitting still and not very kind of, necessarily, in the moment. So this is just in true typical kind of, mindfulness fashion. I just want us to actually be in the moment, because the content that we're going to cover, it might be a little bit triggering thinking about the KSA, and we'll come on to, what your personal reactions when you hear that term might be. But, it's better for your learning and for your experience in general if we just kind of take a moment to ground ourselves. So I think most people have got drinks, which is fantastic. If you haven't got a drink, go and get one. You won't miss much in these first couple of moments. But it is important, like I say, that we just take that breath and we're not on that threat alert, trying to look at the clock thinking, oh, right, there's 1 hour and 50 minutes left now, let's just take it step by step. I have got a PowerPoint, presentation, but I'm not one for necessarily going through it, slide by slide religiously. We might flip around a little bit and we might not get through all the slides, and that's absolutely fine. There will be an opportunity to look at the slides after the session, and also to ask questions as we go through. And I'm going to try and leave a chunk of time at the end so that we do have an opportunity to have a more open discussion, a Q&A. But we'll see how we get on. Okay, right, next slide. So, expectations. Now, I imagine, I'm just guessing here, but I imagine you want to go away from here with some answers. You'll want to go away thinking, that's how you do section 3 or section 8 or whatever. And this might not meet your expectations then, because my suggestion is that you're likely to go away, and if you do go away with more questions than answers, that's really good. Because you have to remember that basically, if you're here or you're in the position to be completing a KSA portfolio, it's because you meet the requirements, or mostly. So bear that in mind, that actually you've got everything that belongs in that KSA, and it's just how you put it together. And that bit I'm hoping to help you with. Okay, so next slide. Like I said before, sometimes we hear that word, that little acronym KSA, and it does tend to have an emotional resonance, you know, and it isn't always positive, is it? You know, it's like, I don't know, you know, you can use the chat function, or you can, you know, put your microphone on and say, what are your emotional reactions, you know, to KSA? You know, what does it do to you? What springs to mind, or what goes through your mind, or how does it make you feel?
A big hurdle.
Yes, yeah, it's a big piece of work. There's no two ways about it. It is, and it must feel sometimes like a mountain. Any other reactions that people are having?
Quite overwhelming, I suppose.
Absolutely.
The amount that you need to do.
It's even though you've got guidelines and you know that you meet those criteria, because like I say, by definition you do, but where to start and where to put everything and how much detail, etc. It's a big piece of work. Any other reactions that people have?
Somebody's overwhelmed there because
you
don't know what's really in store for you. So yeah, a bit fearful as well, maybe a bit unsure.
Yes, absolutely. And they are really common reactions. And to be honest with you, on the other side, when you're assessing them, there's a lot of uncertainty and threat involved with it as well, because again, you've got some guidelines, but they are naturally going to be quite broad and cover a whole lot of, you know, ifs and buts, because everybody's going to come to this with different experience. And you're trying to kind of funnel that into a document. So, of course, that's why it is difficult to just go by the guidelines alone, because your experience is going to be different to other people's. And what can happen, which happens in all kind of student forums, David, isn't it? When you get 2 or 3 people together, you kind of feed off each other's anxieties. And really, that's not always the best strategy, is it, to try and approach a personal piece of work? But there are clearly some things that, you know, you'll have in common, and those kind of things, hopefully, we will cover today, because it's not necessarily about the answers. It's about having strategies to get it completed, really, isn't it, to the standard. Okay, next slide. I've just put this here to say know your barriers, because that's what we're kind of getting at here already. What is it that stopped you from doing it? Because you're clearly bright people, you've got the experience, you can write a portfolio, but knowing the barriers, and we've touched on that already. It's the threat of the task, maybe uncertainty of the task as well. So, you know your own barriers, because when you know your barriers, you're more able to approach it, because that's what we're talking about. We're talking about getting going in the first instance. Okay. So I've put up here in true CBT fashion is trying to kind of apply what we know and what we do with our patients and what we use from CBT theory. And in this case, the intolerance of uncertainty, I think, fits really well when you are dealing with a task like the KSA, because there'll be all sorts of beliefs and rules and things that are being activated in you right now, or when you think about approaching this task. And it's useful to apply what we would, you know, do with somebody who does worry excessively, or who might have high standards. You want to do it right. And you might use a lot of safety behaviours and avoidance behaviours, and that just keeps the overwhelmed feeling going. So you probably find that, you know, you want to do it to a high standard, and that's probably blocking you from making a start. And along with that goes some of the common safety behaviours of needing a lot of information. Maybe this webinar is one of those safety behaviours, and I'm not sure whether it's going to touch the spot yet. Over preparing, checking and rechecking. So going back to those guidelines, how many times have you read them? Seeking reassurance from other people, and obviously putting it off, because if you don't feel you can do it to that standard first time, then you're likely to procrastinate. And like I say, like I keep saying, we want to kind of chip away at that so that hopefully you go away with a different approach to the task. Okay, thanks, Jez. So, you know, even if you're not aware of the full sort of Dugas and Robichaud, you know, intolerance of uncertainty model, that's okay. I'm just picking out some of the elements of that model, which I believe are quite relevant here. It's recognizing, again, if you are worried about making a start, recognize what those barriers are. Is it a problem that's stopping you? i.e., I might not have enough information on that section, or I need to go and find, I don't know, a dissertation that I wrote 10 years ago just to refresh my memory. That's kind of like a problem. You can take action and you've got over the problem. But it's likely that it's the type 2 worries, which are the what ifs, that are going to get your sort of arousal levels going. And we want to, like I said at the start, bring your attention back, be in the moment. And when you are in the moment, you're going to be able to think a hell of a lot more clearly. Okay, next slide, please. And along with this, you know, I'm sticking to the intolerance of uncertainty because we know it has certain behavioural manifestations. And one is it's going to interfere with your ability to actually approach the task. And that is because the task at the moment feels very threatening. So in true, like I say, intolerance of uncertainty fashion, I've just put a few things on this slide which are to get you to kind of have a think about, because hopefully they will help you to approach the task, because that's what we're talking about right now. It's approaching it, isn't it? Rather than just thinking about it and getting overwhelmed. So we recognise that at the moment, if we think of threat at one end and opportunity at the other, you're probably up this end, and that's causing the anxiety. And we'll come back to the threat opportunity continuum, because we want to get you to start considering all the possible benefits of actually getting started and getting this done. Okay. Also, you know, that we know that when you've got this kind of way of thinking, when you've got the procrastination, it's a very all or nothing kind of approach, the black and white thinking. So anything that's just going to get you to think a little bit more creatively, you know, even your environment of when you do it, you know, some people find that you need an actual space and a time, and that creates a kind of a zone for you to do the work. But if that's not working, then just be creative. Think, well, I'm going to do something, or set up a treat afterwards or something. Just be a little bit creative in your approach to the task. Another thing that we always tell our patients is to break it down. Don't just think you've got to do the whole thing in one go, which is probably what we want to do. We want to get it out of the way, but break it down. And we're going to come on to some strategies for that, specifically about what areas might be the normally the simpler ones to kind of get started on. So we'll move on to the next slide. Like I said, this threat opportunity continuum is a really useful way I find. I use this in a lot, not just in intolerance of uncertainty. When you've got black and white thinking and it's getting in the way of taking action. So the threat opportunity continuum then is literally a continuum. We have a line like this, and at one end we have threat, and at the other we have opportunity. And like I say, at the moment, you are likely to be more at the threat end. And when you're at the threat end, you've got all of your what ifs. What if I don't do it right? What if it's not good enough? What if, you know, it doesn't pass? And all of the what ifs are up this end. And it's probably making your anxiety quite high. And we know, as I said, when your anxiety is high, you're less likely to even start. So what we want you to do is start to think about, okay, we know all the what ifs that are getting in the way, but what about the opportunities? What would be the opportunities that this would afford me if I just have a go? Even if I just sit down and give myself half an hour to do something with this KSA, what would that afford me? You know, what would be the benefits of that? And when you consider both sides, it's a bit like a pros and cons. It should make the thinking a little bit more flexible and hopefully help you to take that step to get started. Does that make sense? I'm just trying to use like, well, what a lot of PWPs do as well in the training, which is the CBT from the inside out. I'm a massive believer in actually applying the tools, and they can have great benefit, and that applies here to this task of doing the KSA. Okay, thank you, Jez. So we're going now to start thinking about some of the things to get you started. And I can't emphasize this enough, the importance of reading. Now, as academics, or me, an ex-academic, it's still in the blood. I'm, you know, a big advocate of reading. And if you can read, you know, the more you read, it's never ever wasted. So again, for this task, you probably are thinking, well, I've not got a lot of time. I really want to pinpoint the exact thing to read. Just don't go in with that attitude. Just read, read, read. There'll always be something that you take from that piece of text. It might remind you of something else that you've read before, and then it will spark off what you already know. And then you can just add to your knowledge, and it will, like I say, trigger you, but in a good way. And we can always tell when people have read and when they haven't, or when you're trying to cut and paste bits together. I don't mean plagiarize, I mean your own notes possibly. But actually, if you do the reading first, the prose and the text will, you know, and how that written word will come out will be a lot more fluent and fluid and confident, because it will be informed by what you've read, rather than trying to think about, yeah, I did attachment theory, what do I know about it? I'm just going to write something. Go back to your notes, go back to a paper or a basic textbook, refresh your memory, but just read. Is what I would say the best first step in any piece of work is probably. Would you agree, David?
Yeah, what I was going to add to that actually is, in terms of the KSA that we're kind of talking about, obviously this is about your understanding of CBT as well, and CBT principles, and linking what knowledge and experience you might have to CBT. Now, most of the universities, if you check on the website, will have a recommended reading list. So, for example, Nottingham base a lot of their materials on the beginner's guide, by Anne Garland and Philip Kinsella, which is worth checking out. But for example, like Lincolnshire University, which are now starting a high intensity course, they'll have a different recommended reading list. But it's a really good way of just finding out what are the source materials that the kind of current CBT curriculum is using. And it's just a really good way of just putting that knowledge together, because what you're trying to do is use the knowledges that maybe you've previously gathered through other careers and other courses, and then obviously trying to match that to CBT, to cognitive behavioural therapy. So it's worth checking out those sources, and that might give you a bit of direction and guidance in terms of what to read.
That is a brilliant idea, actually. That is, because if you're filling in a KSA for a particular university, it's always good to go to and learn about the course anyway. So if there are any materials available, that's an excellent idea. It really is. So definitely, you know, go back to the drawing board, just read, and that will just kind of hopefully ignite some, you know, memories or some knowledge that's already there, or just develop your ideas and just sharpen them up. So that would definitely be, you know, the first thing that I would recommend that you do. Okay. And yeah, so as I've said already, read before you write. It's always tempting. We all do it when we've got a report to write or a piece of work. We've kind of got some ideas already, or we might dredge up some ideas or some knowledge that's already there. But it might not be as sharp or focused as it could be if you did the reading first, rather than what we sometimes see, David, I'm sure you still do, is those drafts of essays where people have kind of just written it without reading anything, and they've put in brackets every so often, insert a reference here, and it just even though we can't see that kind of draft version, it really does read that way. It reads like you aren't informed, because, you know, they're your ideas without any critical evidence to support them. So, you know, some of these sections, not all of them, but some of these sections in the KSA are, you know, sort of to be treated a little bit like a mini essay. And in an essay, you would, you know, present your ideas and back them up. And we want to see some of that in there. So, you know, take notes, because, you know, you want to rehearse your argument, and by argument, I mean the position that you are developing, to demonstrate your knowledge, because you've got the knowledge. I can't emphasize that enough. It's about you being persuasive, because that's really what you're trying to do when you write a piece of academic work. You're trying to persuade the reader that you know what you're talking about. So reading is part of that, and rehearsing your argument and being clear on what your position is. And the likelihood is you haven't had time to think what that position is. So treat the KSA as, again, an opportunity. I've got the password here because I've got to let that poor woman in. So just bear with me in 1 minute. But see this as an opportunity to actually indulge yourself in that task of asking yourself, well, you know, this section on psychopathology, which we will come on to, we will spend time on psychopathology. But for example, what is my position on it? What do I think? What do I believe? And treat the KSA as a really good academic endeavour to help you to ask yourself those questions and to be clearer on what your position is. Because if you haven't gone for an interview yet, for a position, or, you know, a trainee post, for example, then doing all of this will really help you to be able to, you know, answer the questions at interview as well. Okay. And, you know, I really do, I've put this here because I've said it already, but this KSA it's a document about your own journey. And the, you know, the person who's going to assess that really wants to get an idea of that journey and be proud of it. I know it's a pain to have to fill this thing in, but also see it again as an opportunity to demonstrate where you have come from. because you will have had a rich pathway if you're at the point of, you know, showing your equivalence to a mental health professional. The likelihood is you've got a lot of knowledge and skills, and this is your, like I say, opportunity to show that. And that's the bit, I don't know about you, David, but when you read the KSAs, that's the bit, if they come to life, where you get a real feel for the person's journey, that's, you know, it's an accomplished piece of work, isn't it?
Definitely. Yeah, written with some enthusiasm, hopefully, as well.
Yeah, some passion, you know, let's really push it. Well, tell us, I remember last time, David, you shared about where you'd actually come from. I know you said a little bit tonight. I'm just putting you on the spot now. But I remember the music element, for example. That was such a nice story.
Yeah, well, I suppose, yeah, fair enough. That's okay. I'm happy to share. So I guess in terms of knowledges, they're probably more easier to demonstrate in terms of knowledge. But I always think my mental health experience came really way before I kind of had a career in it. And by history, by kind of from very early, I'm a musician, and I've been a working musician as well. And music was really my first kind of gateway into kind of the human condition and making sense of the human condition. So, you know, being creative, expressing, you know, emotion and what it's like to be human. And really, I tend to think that actually a lot of my kind of thoughts and explorations in sort of what it is to be human was done through art and music, majoritively, which kind of led me to ask kind of deeper questions, and then almost kind of that's where I kind of led to the science side, really. So it's kind of like that balance of art and science, and it led me to ask kind of actually, what do we know about the human condition? Why do we have emotions? What do we currently, you know, what are the current theories that say that there is some, you know, some kind of function to emotion and the purposes that we experience them. And that was kind of part of my journey, really. So when I started to put my KSA together, you know, it started to make me think about what my observations were. Where did I come in terms of arguments like nature and nurture, and those sorts of things, really. And to be honest, I think it's those kind of personal journeys that help to bring the kind of KSA to life. We want to know kind of, you know, why you're curious about this, you know, what drives your curiosity? Why do you want to know about people? Why do you want to work with people? Why do you want to help, support and treat people? And I tend to think those journeys for all of us start in our ancient history, maybe even, you know, before I became a musician. So it's kind of thinking about, for you, trying to demonstrate some of that journey in terms of like your thinking processes and what's taken you through your career so far. And also, I guess, what aspects of your career so far are pertinent to maybe wanting to work in CBT? You know, and I would still say, you know, my creativity is one of my strengths as a CBT therapist, because I always try and think of creative ways to see the problem, to challenge the problem, to work with a patient and help them to be creative. So hopefully you can bring some of that experience that you've had in previous careers to your role. And think about how you might use that.
Thank you, David. I think it's such a great story to share, because I think you just express it so nicely. And that's what, you know, that's what that KSA should be. It's a personal journey, and that's going to be different to anybody else. And as a core professional, we don't, you know, even though we tick the box, you know, again, we've all got different experiences, and it's asking yourself those questions that David's just mentioned there. You know, where have these ideas come from? What shaped them? And that really is in your own individual journey. Okay, thank you, Jez. So the KSA. What is it all about? As I've just alluded to there, obviously it's a pathway that has been developed so that people who don't have a recognised core profession, seem, you know, as defined by the BABCP, you know, in order to demonstrate that you still meet the minimum training standards which is the key kind of level that we're talking about for entrance to become an accredited CBT therapist. Now, there are two different kinds of routes within the KSA itself. So you might be applying to do high intensity training. And if you're applying to a level 2 accredited course, so that means that that course does meet the minimum training standards given your background in terms of your clinical experience, your knowledge, i.e. the KSA, what's in there. So by the end of the training then, you will have met the minimum training standards to become an accredited practitioner. Now, for some people, they may have done a completely different route. They may have done a whole series of different training courses, which may not have involved being part of a level 2 accredited course. So there are level 1 accredited courses as well. And those courses don't tick all the boxes. There are still maybe some areas that need further evidence. For example, some courses you might still need to do an extra case study or two, or some courses you might need to do some extra clinical hours. But the level 2 accredited courses, once you've finished that, you literally tick a box and you can apply for provisional accreditation. And like I say, those who haven't been on that route, who are filling in their KSAs, may have years and years of experience, but you still have to put that into the KSA to get the provisional accreditation. So it's all about these minimum training standards, which is your demonstration of your competence to practice as an accredited practitioner. Okay. So I'm sure you would have all looked at the guidelines, and you know, as far as guidelines go, I don't think they're that bad. It's just that it's a very, very tough task to have a set of guidelines on. So you know, even though we might grumble about them, and we all have at times, because they are, on the one hand, appear quite black and white, but there's a lot of grey areas. And it's what we've talked about already, is that it's very difficult to develop a set of guidelines that is going to kind of touch the mark for every single person. They've got to be reasonably rigid, but there's got to be flexibility within there because of the diversity of people who will be completing them. Now, that said, you know, they're guidelines, and who likes going through guidelines? You know, it is a tough cognitive task to go through them, especially if it's you who's completing the task. It's the same for the other side when we're assessing them as well. We have to adhere to them and make sure we've got the right balance between sticking rigidly to them and being a little bit flexible in how we assess them. But I don't know what people's opinions are of those guidelines, how you found them, and if you want to speak up or write a chat message or something. So it'd be interesting to know at this point in time, you know, how you found those guidelines. Well, that's stunned silence. I don't know whether that's a good sign or not. Like I say, they are there. They're, you know the guidelines. It is important because ultimately, especially if you're applying for accreditation directly to the BABCP, you know, that is the document that you'll need to kind of know. Now, we do know that over and above what's in that document, there are probably a lot of questions that you've still got about the individual sections, and we're going to have a go at trying to answer some of those tonight. Okay, so important that you know those, but you know, there are obviously things over and above. So I've just put a slide here about tips for writing. So, you know, one thing is knowing what's required. Do your reading, sort of, you know, develop, you know, brush up on some of the areas that are included in the KSA. But then you've got the actual putting it on paper. And I've just put a few things which I'm sure you're all aware of, but again, it's easy to overlook these very simple kind of tips when you are actually in the position to write the, to actually write the reflective piece, your personal statements. So I put here, approach those personal statements like you would an essay, even though, it's not the same as an essay, and not all of them require it to be like a pure essay, but certainly the first 4 sections, criteria 1, 2, 3, and 4, they are like little mini essays because you are actually demonstrating your knowledge. So it does make sense to, approach them in that way. Now, like an essay, we want you to be very confident in your writing style. So we want you to have the active voice. So that means no kind of like maybe or possibly or whatever, or this might say that. We want you to speak with quite an active voice to give that air of authority, and that's you owning your own position. And that comes across as a lot more confident. So it sounds like a simple thing, but it does make a big difference in terms of going back to how persuasive that piece of work comes across, in terms of your knowledge. So critical analysis, again, it's useful to, as David said before, think about your own opinion and how you can back that up. What is it that you have read that really resonates with you or supports your position or goes against it? You might have, in some of those knowledge sections, for example, it might be that, you're talking about some big, theories that you might not actually agree with, and it's useful then to do a bit of critical analysis and state why, that might be outdated or what you think is more relevant now, for example. So, treat those, particularly the first 4, but we'll come on to look at some of the other sections as well. Treat it as an opportunity to, like I say, be very confident in your writing. Be reflective because it does require that as well. It's not just like an essay. You are required to apply some clinical relevance to those statements as well. So I think pretty much all of them, David, isn't it right that you have to kind of put a couple of examples from clinical practice?
Yeah, I think that's really helpful. Yeah,
I think certainly certain ones it's definite, and it's not harmful to put a couple in pretty much all of them anyway, because it's showing how you're making it relevant to your own experience and to CBT, and why you are doing this in the first place is because you want to become an accredited practitioner. Okay. So again, there's a few general tips here because, we can't get too specific. What I'm not going to be doing is providing like another set of guidelines, because that would just be, the same as going back to the BABCP. You might have a few questions answered, but this is more about kind of strategizing, developing strategies for getting started. So here are some, like I say, general tips here. We've obviously got the K, the S, and the A. I feel like I'm doing like a cheerleading routine. Give me a K. Well, the K I would leave till last. Actually, it's S-A-K that we've put here. So we really want the S first. Because actually, if you think about it, it's probably more likely that you're going to be able to write about your skills and demonstrate those probably easier than having to sit down and sort of like reflect and read and think about your position on a number of kind of theories, etc. So the skills section, I always suggest you have a go at first, because then you're going to hopefully get a bit of positive reinforcement from actually feeling, yay, I've done 1, 2, or 3 sections, I've really made a start. And that can be, obviously, what we hope is that that's going to be motivating. for you to continue. So, you know, it does tend to be that the skills one are possibly the easier ones to start with. And likewise, the attitude, because clearly you will have had a number of years of working in health and social care, and you will have, you know, hopefully really good professional attitudes and standards. And again, you should be able to write about those a lot more easily than a set of kind of theories that you're being directed to tell us about. These things are what you already should be able to bring to the surface quite easily, if that makes sense. So the final one then is the knowledge one. Now I have to say, and I know David would agree with this, that these are kind of like the heavier duty sections. When I was course director and we had our reaccreditation you know, visit by the BABCP. Now, I always like to think I'm quite a strict marker myself. I would say I'm quite thorough. But when the BABCP came along and wanted to look at a sample of KSAs that I'd marked, they actually picked up on a couple of knowledge sections that they felt I hadn't gone far enough with. So that's why tonight I'll tell you about those as we go through, because that was a wake-up call for me. I thought, like I say, I'm quite a thorough marker, but it really does emphasize the level they're looking for in you demonstrating that knowledge. Another little thing about a BABCP little anecdote is when we did the reaccreditation, this is just to highlight the complexity of what it takes to be, you know, become accredited. The document that we have, which is called like a mapping tool, that we have to demonstrate that we're covering every element of the curriculum in order to meet those minimum training standards. I bet you can't guess how many items are on that mapping tool. Over 1,000. We're talking about a lot of evidence that goes into demonstrating, you know, that you're ready to become an accredited practitioner. So that's just putting it into perspective, really. So they're not going to just accept, you know, little bits of writing. It's got to be, you know, quite of a, you know, a good standard.
I was going to just make a reference to one of your previous points as well, Helen, because I mean, we were talking about reading and reading the source materials. Actually, that's really helpful in terms of writing about the skills as well. Because if you can identify and you've got basic knowledge of some of the CBT skills, so some of the things that might appear in the source material, actually, I think that'll improve the quality of your writing, thinking about, you know, actually this section's talking about how to assess you know, a mental health difficulty, and I've done something similar to that, and I can talk to something similar to that when I was working in this environment. And so actually it's kind of that previous CBT knowledge will improve your, you know, what you're actually applying in terms of your own knowledge, because you'll be able to do that nice little bit of linking, if you like. I know that this is what they do in CBT. So for example, one of the things we do in CBT is collaboration. So it's kind of thinking, well, I've done that, you know, I've done things collaboratively, and I can think of things where maybe I've done a job in the community where actually it was very team-based, and it was working with multidisciplinary different, you know, people within that team, but also it was working with the clients collaboratively and how they had, you know, some of the decision-making process given to them. And so actually, if you can identify from some of the source material some of those specific skills that you need to have as a CBT therapist, you can then apply what you've done in your career, and that will help you write about it, and that obviously kind of improve the quality of that, if you like. Is that helpful?
Absolutely, it does, because they're all related, aren't they? So our knowledge drives our practice, and our attitude is the glue that holds all that together. You know, that's what draws us to this in the first place, is because, you know, we have got that desire to, you know, be a healthcare professional, to help people and to do a good job. So yeah, that's absolutely right. You know, it helps you to make connections. So the reading is definitely we're going back to the reading. You know, that is important. But yeah, the skills and attitudes, they probably are going to be the easier ones to start with. So are there any questions at this point? Because in a moment, we're going to kind of unpack a few of the criteria. I'm not going to go through them every single one, because like I say, that would just become an alternative guide, and I'm not going to tell you how to do it. I'm just going to give you some tips about maybe some of the what not to do's, for example. So I'm presenting some examples of where and what the feedback was for some little sections. So in a moment, we're going to kind of unpack some content, but I'm aware that I've been talking for a long time. Shall we move on then? Let's start looking at, you know, going through some of the sections. Now, like I say, what I don't want to do is just to kind of have a list of bullet points and saying put this in and that in and the other, because like we said, this document is individual. It's I can't remember what. Say it again.
Idiosyncratic.
That's it. It's idiosyncratic, so it has to be your knowledge. And that might be recent knowledge that you might have a tip from tonight, like, oh yeah, I really should include that in it, and you might go away and read about it. But it will be your assimilation of that knowledge that you are actually putting in the document. And arguably, there aren't any right or wrong things to put in there. It is your display of your own knowledge. So the life stages and human development. So this is the first of the first four criteria, and these are your knowledge ones. And as I said before, these are probably what I consider to be the heavier duty ones. And there are number 3 and number 4 are probably, you know, the heaviest still, if that makes sense. If you've got the background this sort of in psychology, which is required, isn't it? Some kind of substantive kind of study in psychology. It might not be a full degree, but you might have done substantive courses in psychology. Then we are talking about the general kind of theories that you would have been covering in some of those traditional psychology and developmental psychology kind of modules. But it's not that exclusively, you know, that might draw to mind when you first read it. So when we think about this first one then, you don't have to share this with us, but you have a think and maybe jot down yourself, or you might have already done this because you might have already started your KSA and you might have a draft of this already, but just make a couple of bullet points as to what you consider to be relevant kind of theory or knowledge that you might include in that section. Like I say, there absolutely isn't a right or wrong with this, but it's just getting you to think about this now and just starting that process of, you know, drawing to mind what you might put in there. Okay, so just give you a moment to do that. I'm aware that you're going to have to shoot off in a moment, aren't you, David?
I am, unfortunately, yeah, but it's been a privilege to come and join in and speak to everybody. I suppose I am part of the group on Facebook, so if anybody does want to kind of message me or you know, put something in the chat, I'm happy to respond. So I can always catch up with people later on, but yeah, just wish everybody the luck, really. I can stay around for another couple of minutes. So
oh, brilliant. That's great. So going back to this first one, because sometimes some people might be drawn to do it in an order and you might think, right, number 1, and you know, you're really knuckling down to it. But like I say, try and be flexible with it. If there are some sections that you think I could just nail that straight away, try not to be too black and white in how you approach it. But when you do come to this one, what I'm going to do, which you had a little, you know, preview of this, what I'm going to do is put some anonymous and some very brief little sections out of some real KSAs. And I'm going to present the information and get you to read it and to be critical about it. And you know, you can write some notes. We can have a you know, reflect on that, because that's what I'm going to get you to do, for you to be critical now, rather than just thinking about what the content should be and I'll go away and read that and do it. I want you to have a look at somebody else's attempt at doing it and see what you think. And that's going to hopefully help you to be able to ask those questions and then apply that to your own attempt when you come to do it. And like I say, you might have already done this, you know, some of these sections already. So let's put it on then, Jazz, please. So this is, you know, a section. This was actually, I should say, this was the complete first draft of this criteria for this particular candidate. And I want you to spend a couple of minutes reading through that, make a couple of notes, and we'll have I want us to have a little discussion about what your thoughts are on the strengths and weaknesses of this section, you know, this version. Okay, let's get some feedback. What are people's thoughts on this statement?
Can you hear me, Helen?
Yeah, I can. Yeah.
Can you see me?
Yeah.
All right. I think it's well written, but it's not. It's a great insight into our career and what she's achieved in like adulthood, but there's not a lot there about him or her, and how she, if there was any kind of like examples she could have from her own childhood, or you know, going into like early adulthood or something like that. I just don't feel there's enough about the person of their life stages or of their own personal human development. But great, it's great how it's written, but that's like after.
Yes, it's not very substantial. Let's put it that way. It's not. If we're considering this needs to be a real kind of good demonstration of your knowledge in that area and treat it like an essay, that doesn't read like an essay, does it?
No. No.
Any other comments about that? You know, what your thoughts are on it? Because in a moment I shall put up a slide which is the actual feedback that was given about this statement. But has anybody got any other thoughts about that statement? Any reflections?
I was wondering if you should make room for things about like what it actually means to you in practice.
Yes, there is a lack of connection to, isn't there? Yes, I would agree. There isn't that, yeah, you're right. It hasn't got that feel that it's being applied or demonstrate how that knowledge has been applied and how detailed that knowledge is as well. Any other comments about that? There's a few glaring things. The length of it is one thing. You know, we would expect 2 to 3 pages for these knowledge ones. There isn't a magic number, so if you do 2 pages and it's fabulous, you know, you're not going to say go into page 3, but certainly more than kind of like, you know, half a page or something. We're talking about, like I say, the knowledge of theories, and back that up. These are kind of lists, almost like bullet points, and yeah. So let's move on to the feedback then, because there's a few things here. I have said that criteria 1 to 4 in particular are for you to demonstrate your knowledge, gained primarily through your degrees and for the study. So there is a given that we know that you would have done certain courses, and that will be evidenced within the portfolio. We'll know if you've done what courses you've done, or A levels or whatever. You don't have to name people or institutions or even necessarily courses, because that is given that you've done those courses. This is a demonstration of what you've gained from it, if that makes sense. So, you know, in terms of, okay, I did a psychology degree. Well, what did you get from that that actually, you know, has informed your knowledge about, you know, development or lifespan? So again, the main points here were, you know, it was kind of superficial level. That was, there wasn't a great deal of kind of assimilation of that knowledge, packaging it up in a kind of a kind of persuasive way, as we were saying, like developing an argument or a position on some of those theories. And there was, you know, just a lack of substance to it. And again, you don't need to mention names. It's not the appropriate place for that. You will have sections within the KSA where you do need to put that information. But this is more like a narrative, you know, stitching together all of that information. And yeah, does that make sense?
Yeah, it's a bit like it's everything that's been achieved academically, but there was nothing really applied to.
Yeah, absolutely. We know that you've got a sort of psychology, but we want to know, what did you take from that, and what, how is it relevant here with this particular, you know, subject, and how does that then, as David said, feed forward if you want to be a CBT therapist? What is it about these theories that is going to inform you in that role?
Yeah, it's like I feel it was lacking a wee bit like empathy. It was just like kind of like there was no, as you said at the beginning, there was no like kind of reading done, or she really knew what she was.
It's a common thing. A lot of people will write the first version exactly like that because you don't know what to expect. So it's not that it's bad. It's just that that's how you think it needs to be presented, if that makes sense. And that's why I think there is a lack of this kind of information.
I mean, if I was reading that, I'd be like, wow, she's really, or he's really experienced. But, you know, like someone that's maybe at my stage reading that, I'd be like, wow.
Yes, but does that make sense then? We're looking for, or, you know, the BABCP in particular will be looking for evidence of how you apply that knowledge. Okay. Another thing to say about the lifespan one is that, remember, we're talking about a whole life. So some people forget to put older age in that, and some people forget to put adolescence in. We're talking about your knowledge of the lifespan. So that includes childhood, adolescence, adulthood, and older adulthood. And are there, you know, what were the theories or, you know, whatever that help us understand, you know, development and what we might need to be aware of when we're working with those different age groups, for example. So does that make sense in terms of, you know, the kind of thing that you might put into that section then?
Yep.
I've got a question here. Can you? Yes, we want the I've got a question here from Fiona. Is it to everybody? No. So can you apply the specific clinical examples via reflection? Well, yeah, we want that to be included in the statement. So yes, we want you to you know, apply that within the individual statements. So for this one, for example, it might be that you have worked with two different age groups and you approached it differently depending on your knowledge of you know, that particular life stage, for example. Does that make sense? And so yes, you want to be reflective because that is your practice that you are integrating into that statement. Okay.
Hi Helen, hi everyone, my apologies I was late. My apologies to anyone who this doesn't apply to, because I need to do the KSA. I've actually only just completed sort of an official course, so, and as I'm not working with any clients at this moment, my question by the reflection was, after having done the course, I could think of lots of examples where it all kind of clunked together.
Yes.
So it was that, given that I have very recently done the course, I wouldn't have applied the theory almost at the time.
No.
It would be more like just a general knowledge.
Yes. But what, you know, for example, though, have you got other kinds of clinical, you know, experience that it might not be current, but again, if you could have a reflective example of how you maybe have seen, you know, that theory, or how that theory might be relevant to, you know, working with people in other settings. Does that make sense? Because this, obviously, the KSA is your journey. So, but it might be that you're not going to be ready to submit it immediately, but it's about just thinking about how you might express that without it even being, you know, just related to the current stuff. So you might be able to reflect back, like you say, that, oh, now I've learned this, I can see, looking back, that when I was working in this area, that makes sense, if that makes sense.
Well, I suppose that was it, but my question is now, having just completed the theory, the official theory, whether I can look back and go, using that and that. Oh, okay, lovely, thank you everybody.
Definitely. And that, even if, you know, you then go on to get more experience and you know, add those in, definitely, because we want to see you making those connections.
I have one quick question. It shouldn't be too long. Are you looking for us to state particular theories, and I suppose, are you looking for references as well? Do you need us to reference the work, or just mention the theories and sort of the key learning and how we would apply that?
Well, there aren't any particular. There's some, obviously, there are going to be some big ones that are going to be mentioned, but actually, you know, again, I can't emphasize this enough. There is not a checklist of the right or wrong way to do it. It is how you do it and how you present that information, but it is your knowledge. So it's you thinking back and reflecting on those degrees and what is it that stands out about, you know, what you learned about the lifespan or development, and how is that relevant to you working in the mental health field. So in terms of references, I always like, you know, you don't have, it doesn't state that you have to, but I always think it does look better if you're saying something blah blah theory and you've backed it up and you've got a reference or two. You don't have to have like a big reference list, but if you are naming something, I do think it looks good if you know, have that at the bottom, but it won't be a deal breaker if you don't.
Okay, thank you.
Okay. So shall we move on to the next section? Because like I say, I've got a selection here, and these are the ones, particularly the first four, because I think it's important to focus on those four, because they're probably the ones that you might want more, you've got more questions about how to do them. Because like I say, the skills and attitude, they're yours already, and you're probably more likely to be able to talk about those, even though I've included a couple in here. So the first four I would like to go through in a little bit more detail. So this is obviously criteria 2. And yeah, we could put the next slide on, Jez, thank you. Now, for some of these, I should just say that some of them I do put you know, a bit of a statement, a real statement to give feedback on, but some of these I'm just presenting the feedback, the common feedback, you know, in relation to some of the areas that often need improving, if that makes sense, because this is the kind of information that you probably don't get in a guide, but this is feedback that's, you know, I've kind of pulled together that are common comments in relation to some of these. So obviously in the guide, when it comes to number 2, it does talk a lot about the legislation, doesn't it? And you know, different acts to reference. And to be honest, it can seem quite dry, this one, if you just go down that route and only focus on legislation, you know, guidance and etc. Of course, they are important and they are part of this. But when we remember what it's called, it's health and social care approaches. So clearly legislation is part of that, but you try and think a little bit more laterally about your understanding of those systems and, you know, those approaches that you have worked within, or the knowledge that you've got of them. So, for example, in the guidelines, I don't see much about social care. And it might be that, you know, you've had experience of working in a multidisciplinary team, for example, and you might have worked with social workers, and this is knowledge, remember, so it might be that, you know, you compare and contrast, you know, the different approaches to caring for a particular, you know, client group. For example, I've got a background in learning disability nursing, and when I did my training in the 80s, it was at a time where there was a lot of debate over, you know, who should have, you know, who should be the provider of care for people with learning disabilities. And there was legislation and acts all being passed. And the thinking at that time was that, you know, there shouldn't be learning disability nurses because that's very medical, and that actually social workers should look after people with learning disabilities. So if I was to write something about this, I would go back historically and look at some of those issues. And again, if you're thinking about health and social care approaches, remember we are talking about the context of mental health. So any knowledge you've got of, you know, the historical perspective, you don't have to go into a lot of detail, but, you know, what is the system that we're working within now, and how does that compare to other approaches? So I'm just getting you to think of some questions to ask yourself, and then it's you answering those questions within the statement. Does that make sense? Yes? No? Have you got any other questions about this particular criteria?
Yeah. For example, so would you put in something like, okay, so I'm a PWP. If a client comes up with a difficult situation, I would approach it, I would treat it differently. But if they had another aspect of the difficulty, for example, some children issues, you know, benefits or whatever, but I would get in our team social worker, I would use their advice. Would I put that in? Would I say that is what I would do?
A really good example, wouldn't it, of applying your knowledge, because you know when, you know, a referral was necessary, and that will be based on your knowledge of the social care system. Does that make sense? And where does that come from, and how do you express that? Yeah, I know enough about it to know that actually that's going to be a more appropriate care provider for this person at this time. Does that make sense?
Yeah, it does. Thank you.
Okay, thank you for asking the question. Yes, Lars?
I'm from Denmark, so of course I don't know a lot of those things, but I was kind of thinking about writing up what I know from Denmark and how we work there, because it's pretty much similar. But otherwise, I don't really know how to.
Absolutely. You've got then that kind of cross-cultural comparison, haven't you? So you're not only kind of, you know, bringing your own personal experience and knowledge, which has come from your own background, you know, from your own country, but then your knowledge, your current knowledge of the health and social care systems here. And, you know, you can be quite critical with that, can't you, really? You don't have to go again into huge reams of critical analysis, but it does give you something, another angle, doesn't it?
Yeah.
So that cross-cultural aspect is another layer, and that's, you know, like I say, being more critical. So, you know, that's great. Okay, so is that okay for that one? We can always come back, because I'm going to, you know, have a decent amount of Q&A time at the end. So if there's anything that you're burning to ask, don't worry, because hopefully there will be enough time at the end. So I'm going to move on to the next one, because it is a biggie. This is probably one of the ones that gets done the worst. It really does. It tends to be the one that always has to be redone. I have to say it probably has, or I don't think I've ever read one where it has been to the standard immediately, and that's why it's really to kind of forewarn you about that, because it's perhaps something that you don't give a lot of thought to, basically because you are working within your own philosophy of care, if you like, or care system, and you don't perhaps take that time to stand back and say, well, what does psychopathology mean, and what do I believe about it? So I will open the floor if anybody knows. Before we get on to a statement, I have put a statement in here, because the first thing to ask yourself, and you don't have to share this, but to jot down on a piece of paper, is to ask yourself, what is my understanding of that term? Without Googling it, just to think, what does that term mean? And what does it mean to me? And how does it direct the way that I work with people who, you know, are presenting with mental distress? The diagnostic skills, that tends to be the bit that people jump on, and you get a lot of detail about that. But the first bit, the psychopathology, is a really essential and a fundamental sort of concept, if you like, that you should ask yourself that question. What does it mean, and what do I think about it? Now, does anyone want to just give a brief description or a definition of psychopathology? It's not a trick question, but it is a complex issue, but you know, the actual concept is not complex. What it means, well, if we break it down in the Latin, the psychopathology, pathology or ology is a study, isn't it? Pathology is the study of disease. Psycho is the mind. So it's basically the study of mental disease, mental illness, as it used to be called, and is still called within certain, you know, sort of perspectives. Or approaches to psychopathology. So really, this is the bit that there are different positions on. So psychopathology is the one size that fits all. What do we mean by it when we say somebody's experiencing a mental health problem or mental distress? Psychopathology, we need to be able to have a framework to understand that distress. So, and there's more than one way of thinking about it. Because if you think about it, if there was just one definition, everybody around the world would recognize if somebody comes in crying, that means they're depressed. It might not to some people. So understanding what we mean by, you know, mental health problems, mental distress, however you want to conceptualize it, it will hang on a way of understanding it. Does that make sense? It's a big one, it is, because it does require you to ask those questions rather than just going along with a way of working without questioning, what is my position on this? What model am I working with? How am I understanding this person's distress? What model am I using? And how does that inform my understanding? Does that make sense?
Yeah.
And remember, there are more than one approaches. So the medical model or the biological model has been a dominant one, hasn't it, historically? And it seems to have come back into fashion within IAP because we do a lot of measures. There is that idea that you can measure distress, and that falls within a certain, you know, sort of like understanding, doesn't it? So I absolutely love the subject, and I think it's an area that, although it's a big piece of work to do this particular criteria, it's also a really fundamental one for you to really, you know, read around it, think about it, and just sort of like bring that position out. And you can really be quite critical about this, because we've not only got historical perspectives on it, we've got different ways of thinking about mental distress, haven't we? So from a CBT perspective, what kind of psychopathology are we using? How are we making sense of people's distress? What are we hanging that on? That's for you to ask yourself. You don't have to answer it here, but these are the questions. It's kind of more philosophical, but there's also a way of weaving in the science to that, because if you take it as being a scientific study, that is assuming a certain type of understanding of what counts as relevant knowledge. What do we need to understand how to help this person? So again, this will all depend on your own position, and that's why it's important that it isn't a checklist. It's you going back to the drawing board and saying, well, okay, yeah, I've not really thought about this for a while, so what do I think, and what might I be able to bring into this from, you know, courses that I've done, or, you know, reading that I've done, and it all goes in this section. Okay, let's put an example up then, Jez. Thank you. So again, I'm going to get you to have a read of this statement and just jot down a few reflections on it, and we'll go through those reflections in a moment. So any reflections, any comments about that statement as it is there, in terms of what we're trying to demonstrate in this criteria?
I think it's quite good where on the third paragraph, second paragraph, to complement my framework of provisional diagnosis, I have developed my questioning skills to identify disorder specifics. So that's like open-ended questions. So you get more information from that person.
But what is the psychopathology behind that, though? You know, what model of understanding a person's presenting problem, that doesn't appear there, does it? It's not being hung on anything apart from a set of procedures that haven't got the kind of theoretical backing. Does that make sense?
Yeah, because it mentions the DSM-5 and the ICD-10 diagnostic system. But
well, let me put it this way: if you gave a DSM-5 to somebody in China, would they still come to the same conclusion as this person who's worked here? And
no.
It's making that clear. Well, what is it? What's my understanding? Why do I believe the DSM is a useful tool then in diagnosing?
If you can't, I used it in certain studies that I did, but I always put according to the DSM-5, and then whatever the disorder was, but then I backed it up with the actual knowledge that I got from the client itself, and that's how I kind of related that.
Yes, so then let's explore that then. So if you're going over and above a set of kind of criteria, which basically is you could argue it's I'm going to use the term, it's nobody's mentioned it yet, biopsychosocial. You know, it covers the different areas, doesn't it? You know, here we're talking about DSM, and in a lot of ways it's the bio, but it does have the psychosocial elements in some of those descriptors, doesn't it? So broadly, what we are trying to do is understand the person's presenting problems over and above just the medical or the physical or biological, i.e. not a set of symptoms only. We are really working within more of a biopsychosocial model with CBT, because if you look at the 5 areas, we are making sense of a person's distress, aren't we, by looking at some of these different elements, not just. So even just being able to name what kind of understanding you're using, that's what we're talking about. And there isn't really that definition here, is there?
No, not at all.
Any other comments about this? Anything, you know?
Hi, sorry. Sorry if you hear my little one in the background, but for me, this would be something that I would kind of write, but I think just putting the biopsychosocial element into it does add another facet to it all. And it just makes me kind of think about, I could probably bring in a lot of my neuroscience kind of degree into it, which will bulk it up a little bit more and also give me a little bit more to reflect on.
Well, that's your knowledge, you know, it's not about bulking, it's already there, isn't it? That's what you've gained through doing those courses and gaining that knowledge. It's just bringing it to the forefront and seeing how relevant it is here, isn't it?
Yeah, definitely. And I did struggle with this bit. So.
Yeah, it's a complex concept, particularly if you don't think about it very often. We just do it, you know, and that's, you know, it's not a criticism of anybody here. I just have a particular passion for it. So I do think about it a lot. But, you know, when you do think about it consciously, you will have thoughts and beliefs and positions on it. It's just that you've not packaged it up in this way before. Does that make sense?
Yeah, definitely. Thank you.
And that gives you your reason for why you're doing what you are doing. That is the framework to hang it on.
Yeah. I'm just going to mute now because the little one's going off.
Yeah. So let's move on to the next slide, because I've got some feedback here. It won't surprise you, some of the things we've already talked about, and that is that you need to have kind of like a clear definition of psychopathology, but it doesn't have to be, like I say, there's not one right way of defining it, but showing an understanding that it is multifaceted, or there are different approaches to it. So as Lars has already said, you know, from a cross-cultural perspective, it might be that, you know, people in Denmark might, you know, not use the same kind of frames of reference that we might use in some of our health systems to understand, you know, presenting problems, for example. But going back to the feedback from that particular statement that you've just had a look at, it does, you know, kind of just stay within the kind of medical model, really. And that's fine. You know, I'm not saying there's anything wrong with the medical model, but it's putting it into context and demonstrating your knowledge over and above that. And if you are a true, you know, supporter of the medical model, then make that case, make it critically. And that will be, you know, where that position has come from and what is supporting it. Because we're not saying that one position is better than the other. It's your ability to demonstrate it on paper. So in terms of length for this one, you really do need at least 2 pages. I'd say go into a third, but 2 pages, because, you know, you can see it's a heavy kind of subject, and there's a lot that you could draw on to include here. And I can bet that when you do this one and you nail it, you'll feel really good about it, because it will support your own kind of, you know, knowledge, and you'll be able to answer a question really well on it, you know, like in an interview, or just to be able to back up why you're doing what you're doing. Anything else in there? Yeah, I think we've pretty much covered those comments. So the next one then is number 4, which is the models of therapy. Now, often this appears like quite a straightforward one, and in some respects it is, you know, because the degrees and studies and courses that you would have done, you know, and the people you've worked with, will be, you know, diverse, and you'll probably have, you know, a good understanding of at least a few other models other than CBT. But for this particular criteria, that, you know, it's what they expect in this section, which is the, you know, the thing you need to be mindful of. So it's how you demonstrate that knowledge, and how detailed, you know, that knowledge is presented, how much detail you put into it. So if we move on to the next slide, like I say, there aren't examples for each of these, but for these first four, I just felt that, you know, at least 3 of them warranted you just to have a flavour of the types of things that people might put in, and just give that a little glance, because I do want to focus more on the feedback. Okay, well, let's put the feedback up, because you get a kind of idea of the kind of things that are on that statement. Now, I haven't gone into a lot of detail about this, and I'll tell you for why, because I'm not going to reinvent the wheel. There is a really good bit of advice about this one, and I'll come on to it in a moment. But there's some key things to recognise when it comes to this one, that they want you to demonstrate your understanding of at least 3 approaches, you know, like I say, other than CBT. So, and it is quite clear, I must admit, for this particular, the guidelines are very helpful for this one, because it does kind of tell you what's required in terms of the depth of knowledge. Now, there is also, and I include this, I put a copy on the Facebook page, but you can Google this even. It's from Sheffield University. They do their own sort of guideline on completing the KSA, and it is largely based on, I mean, it largely repeats a lot of what's in the BABCP guidelines, but they do a few little extra notes here and there throughout, you know, just to give some tips. And the section 4, they go through in more detail than this, and it tells you in terms of what sort of level of knowledge is required to include, and that if it wasn't covered in like a degree, it gives you some examples of how you might make up that knowledge and how much is required. So like I say, I didn't want to just read through off somebody's handout, and that information is available. So I would suggest that you have a look at that in terms of the models of therapy. There are some broad things here, and, you know, in terms of giving those illustrative examples, they do have to be quite, you know, backed up with some good level of knowledge about those types of therapy. Because, for example, it wouldn't be enough to say that I work in a multidisciplinary team and CBT wasn't working for this person, so I just referred them for counselling. You'd need to really demonstrate a good understanding of what that rationale was, but based on more than just working in a multidisciplinary team. It's the not, remember, this is a knowledge section, but it also has to integrate your practice as well. But we want to see, you know, a good level of detailed knowledge. Okay, so moving on then, I have kind of, you know, done a random selection. They're not actually random. I've picked these for particular reasons, but they look a little bit random, because I'm not going through them, like I say, every single criteria, because some of them you'll be able to kind of go to even tonight if you really wanted to and were really keen. You would probably be able to bang out a couple of these, you know. But like I say, I just wanted to give some sort of tips on some of these other ones, other than just the knowledge. The knowledge ones really do require more thought. But even this one, the competency and key relationship skills, it's likely you'll make a really good job of this one. So I'm not kind of highlighting things because they're difficult. I'm sure you would be able to do a good account of your, you know, competency and key relationship skills. But if we move on to, because like some of these, like I say, I've just put little bits of feedback just to be mindful of. So although it is a skills section, we do need to incorporate your knowledge of theories and models that guide your understanding of effective interpersonal skills, for example, beyond Rogers' core criteria, because we hear that said a lot of times, you know, about the core criteria. That's great, but what are the models or understanding of, you know, sort of the therapeutic process or relationships, or, you know, what other knowledge can you, you know, put into that section over and above, you know, just some basics there. Okay. The next one then, I think this is number 8. And this is another skill one, so it's awareness of risk. And again, it's likely that if you work in a healthcare setting, that risk should be relatively straightforward for you to write about. But again, there's just a few elements that it's just about bringing it into the frame. So if we have a look at the feedback, because all of these feedbacks are actual feedback that have been given on various KSAs, and a little bit of an amalgamation of some of these. So they are, you know, actual feedback that I've given to people for these different criteria. So there's just a few little extras that you might not think about when you think of risk. We, you know, consider risk as, you know, to and from others to self. So that's not just risk to the person themselves, whether it's suicide or self-harm, or that they, you know, it's about risk that they may, you know, the safeguarding kind of issues, for example, that they may be in an environment where they are at risk of harm from others. And remember your position as well as the therapist. If somebody is coming in risky, what kind of measures and what knowledge do you need in order to kind of, you know, assess that situation adequately and competently? Okay, and again, it's an opportunity to put a bit of theory in there as well. So where did you learn about risk? Of course, there's going to be policies and procedures, but for example, I've just thrown something in here, I think, or I might not have. I'll throw it in anyway, and that is, you know, if you were thinking about risk in a broader way, not just about risk aversion, which is often what we do in medical settings, is that we try and manage risk to make it almost go away. But there is such a thing that's called therapeutic risk taking. And if you were to take a different perspective on risk, you might try and encourage people who you're working with to actually take a few more risks, rather than being so risk averse that might be fueling their own anxiety, for example. Does that make sense? Any comments about risk? Because obviously it is a fundamental skill, isn't it, that we need to have. It's always on the mandatory training. We have to be reminded of those skills and managing it day to day. But again, it's taking the step back and asking yourself what your own position is, and, you know, what's driving my working in this way. So, yeah.
I think as well, it could maybe be down to, you know, like one of the skills is good listening skills. So a client might be blah, 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 and saying away, but she could, or he could be saying things that are of risk to others, with, you know, even if it is just a thought, you're going to carry that out.
Absolutely, you're going over and above a checklist, aren't you? You're not just, you know, asking a rigid set of questions. You're absolutely right. You're using those other therapeutic skills to observe and, you know, ask questions over and above the actual, you know, item of risk that you might be focusing on. But absolutely, it is. That's what we're saying. It's kind of more integrated, and it's an opportunity in these statements for you to maybe use a couple of examples where perhaps you did do it, you know, it was tricky, or you managed to get over that in some creative way or whatever. But, you know, it's applying it, isn't it?
That's right.
How you apply it. So
this might seem like a really obvious question, and I apologise if it does.
No, there's no such thing.
So my only concerns with things are when it comes to stuff, obviously the sections like this, for example. My background is social work, so risk to me might be completely different to what it would be for someone who's already sat in a therapeutic role. So would that play a big difference of being marked differently?
Remember, this is an individual document. It's your document, your experience, and your knowledge, and so it can't be marked down, because that's where you're at right now, and that's your experience, and it's your understanding, and it's your background. So, you know, there's, like I say, it's an idiosyncratic in relation to your own experience, your own journey.
Yeah, so as long as we're putting forward like the health and social models, things like that to back everything up, then that's obviously going to be, okay.
Absolutely, because this is the statement is your demonstration of your understanding and your practice and your background, isn't it?
Yeah.
And you know, you can always add another layer in, like, even though I've not used it in this way, I'm aware of, because I've read this or been on a course for that or whatever. You don't have to have applied everything, but it's demonstrating what you have applied, and you know what you could apply if you were in the right kind of setting, if that makes sense. You're demonstrating that set of skills. Brilliant. Okay, we're going to move on to the next slide, because I've jumped on a little bit to the comprehension of research, because again, this might appear quite straightforward, which on one hand it is, isn't it? You know, but it can be done quite weakly. You know, the demonstration of how you understand a piece of research. So, of course, you know, it goes back to what I was saying at the start and throughout this webinar, and that is going back to the reading. You know, it all starts there, you know, and that's where your understanding of everything will come from. It will be guided by that. So when you approach a journal article, for example, how can you demonstrate what you take from that? What happens when you pick up that article? Let's say it's like that. You pick up the article, you read it. How do you know whether it's good, bad, or indifferent? What skills are you using to make that call?
So you could maybe do something, and if you hadn't experienced it personally or knew someone experienced it, you know, you would feel a sense of sympathy or sympathetic towards that person's situation. But for example, if you had experienced maybe something similar, then you would feel probably a bit empathy towards them.
But we're talking about comprehension of research for this one. So if you've read, are you talking about like reading an article? How do you know if it's good, bad, quality, whether it's something you're going to really learn something special from, or whether you can dismiss it? How do you make that call? You know, what are the skills that are involved in doing that? The academic skills, because that's really what we're kind of getting at here, isn't it? How do I understand a bit of research? You know, how do I make use of that information?
Well, you could maybe then see what this piece of paper is saying, if it was something that you hadn't done before, and then whatever information or examples it gave you in that research paper, you could research what they've said to back it up, or to agree with it or disagree with it, or
well, let's put the next slide up, because we've got some very general stuff which, you know, you are mentioning. But remember, you need to demonstrate your critical appraisal skills. So it's not just I've read this, I've read that, and I was persuaded by it. what was it about that piece of work that you've read about that impressed you? You know, demonstrate those critical appraisal skills and how you make sense of evidence. You don't just accept it, you have to be able to say why. So references to research and how you approach reading, how you assimilate the content of what you're reading, and how you then, you know, sort of like, you could use an example of, oh, I read this really good paper, and say what it was, you know, show those skills of how you approach the paper in order to come to that conclusion that it was a good piece of research. And again, these are all positions. There's no right or wrong answer. This is you expressing your own opinion, your own position on this. But, you know, it's something to be mindful of, because some people might just go, yeah, I did a research degree, so I understand research. But it's more demonstrating those skills. Does that make sense?
Yeah. Yeah.
Brilliant. Well, let's move on, because like I say, I want to just cover another couple of you know, criteria with a couple of points, and I do want to kind of like open the floor soon for any open questions. But again, this next one then, commitment to ethical principles. Now we are kind of getting into more the attitudes kind of section. And again, you will have a position on this, you really will, but sometimes it's the terminology that throws us. We could think, oh, ethical principles, you know, yes, I know I'm ethical and I follow, you know, guidelines, but what do I actually mean by that? What are my own ethical values and principles, and where do they come from? So again, some of these are quite philosophical. You're going to have to ask yourself questions. That's why I said I'm not giving answers, I'm getting you to ask those questions, but they are the right questions for you to answer yourself. So let's move on to the next slide, because again, this is just a bit of, you know, some little tips here. So what are the ethical frameworks that you might use to, you know, guide your practice and make sure it's ethical? We know that there are going to be standards. That if you are obviously under the BABCP, you will work to their code of conduct. It will be their ethical principles that if you're a member, and certainly if you are, you know, but even if you're a member and not even accredited, you are adhering, you should be adhering to their ethical framework. But there's other ways of thinking, like I say, of what is ethical practice. So there are, I come from a nursing background, like I said, and there are, you know, certain models that we're taught in nursing. And if you're from a social work background, I'm sure there are, you know, other models that you would have learned. It's just remembering, going back to and refreshing your memory, or even just going and looking for some. And this, I put Beauchamp and Childress because they are, you know, that is quite a standard kind of model that a lot of healthcare professionals would be quite familiar with. But it's not to say that that's the right one. It's just one that I dredged up from the past, but it is still really used a lot in nursing. And again, you know, set a couple of examples around ethical dilemmas that you might have come across in your own practice. So things that might have been tricky because and that's normally when something resonates or doesn't sit right with your own values, but it's kind of like jarring in some way. So have a think about some of those examples and how you reconciled them and got through them. Over and above, I asked my supervisor, we want to kind of see your thinking processes in there as well. Of course, it's appropriate to ask your supervisor, but we want to see how your mind works in terms of how do I know when I'm being challenged that something's going against my own beliefs, if you like, and how did I get over that? Okay. The next one then, we've got self-evaluation and reflection. And again, this should be straightforward. It's not difficult. I've just put a couple of a few bits on the next slide. If we have a look at that, just to kind of just again sharpen up what you might actually put in this section. So again, drawing on a framework that you might have used in, you know, in your training, if that was another, you know, course that you did, or, you know, so there are reflective models. It's quite useful to give an example of how you might have used a reflective model. But again, there's just some questions on here to get you to kind of hone in on that knowledge and position and what you believe, because the attitudes are about your own beliefs and values, basically. So this is a chance again to answer those questions yourself. Okay, so I have just got one more section that I wanted to quickly go through. And this is, has an inquiring mind and receptive to the scientist practitioner model. And if we move on to the next slide, the reason I put this one up is because, again, there are some issues that often arise when people do this section, and there are certain things that might be missing. And again, arguably, like all of the rest of it, there's no right or wrong. But if you're looking at the scientist practitioner model, you do want to actually be able to say what it is and where it comes from. So ask yourself that and see what your answer would be. So, you know, what is your position on it? Do you think it's a good model to aspire to? Are there times where it might not have been helpful for a certain presentation or whatever? And that's an opportunity again for you to be critical of it, rather than just saying, yes, it's because it's part of, you know, how I've been taught. It's whether you buy into it. And if you're doing CBT, I guess you must be buying into it to a certain degree. But I would argue there are still different ways of thinking about it, rather than just accepting it as the only way to approach treatment. Like I say, I am sort of like generating more questions, but that is intentional. So yeah, so these are just some questions to ask yourself so that you're honing in on, okay, well, what is the scientist practitioner model? We know Beck talks about it. If I even just take the science bit, what are we trying to do here? And does science actually fit all the time? And when it doesn't, how might we think about the scientist practitioner model then? So, you know, again, this is your opportunity to state your position. Okay, so they are all of the kind of the criteria that I wanted to cover, and I realise that we're kind of like out of time, but if you're okay, I'm okay definitely to hang around for a few minutes. Definitely. I mean, I will be here for longer than that, but I do appreciate that some of you might need to get away or want to get away, because 2 hours talking about KSA is probably enough. But what I would suggest before you do leave is just to go away with an idea of creating an action plan for yourself. So, you know your barriers, like I said at the start. And are there any things that you've heard tonight that might help you to overcome or address those barriers? Because we've said before that you've got the knowledge, skills and criteria, the attitude, but it's the barriers that are getting in the way of getting that on paper. So it'd be really good if you go away with at least, you know, one action that you might do after this. Okay, the next slide then is just to reiterate, which I have said on all of those abundant social media adverts for this, is that it comes with a you know, backup support. I'm a big believer that if you've done some training, we often will walk away and it goes. And I think that having, you know, some follow-up peer support is really useful. So and also it's an opportunity for me to put some materials up and people to share as well. And that's why, because this is going to be a big recording file, I will be putting it into that private Facebook group. Now, I appreciate that not everybody is on Facebook or wants to be on Facebook. And if that's the case, then do let me know and I can email it you. But it is a massive file and we'll have to use one of those like WeTransfer, you know, the software to do that. But that is possible. And anything else? We've got the CBT careers page, which probably a lot of you are familiar with. That might be where you have seen me. But I also offer some one-to-one consultation if that's something that you would like to do. Because like I say, everybody's different. I've given you some general guidelines there, or not guidelines, are they? Tips, strategies, and things to think about. But if you do want that one-to-one support, then that is something that's available also. So next slide is, that's just what the Facebook group looks like. And there is more than 2 members now. There's about 20, I think. So, you know, I will keep that open for the next few days and you can access that. I will be getting the recording edited. Thanks to Jez. And we'll get that put onto the site, you know, onto the group as quickly as possible, and the slides. So, you know, you will have some access to the slides if, you know, you want to go back and look at some of those feedback, you know, examples. So next slide then. Like I say, if you did want face-to-face or one-to-one support, and that can be, you know, doing a video session, or I do what I call a pay-as-you-go scheme. So you buy minutes, and if you want to have a 10-minute chat and then save some in the bank, and I can look through a written example for 50 minutes or something and give you written feedback, you can use those minutes how you want to make them flexible. And because you've come to the webinar, I like to give you a discounted first hour. So you just pay for 30 minutes but get 60. So that's just something, if that's something that you would like to do. So finally then, even though we've gone over, if anybody is still here and would like to ask any questions, like I say, I'm definitely going to stay around, but I do appreciate that, you know, we've come to the end. And if you are leaving right now, thank you very much for your attention. And you will receive like a Zoom little feedback questionnaire or survey, probably tomorrow, or certainly within the next 48 hours. And your honest feedback would be really, really valuable. Okay, so thank you very much, like I say, for your attention and everything. You know, and if you've got any questions, please do ask, or any comments. You know, this is your opportunity.
Just thank you very much, Moya. It's been a great 2 hours. It's just brilliant, and I've learned a lot, or a better insight into what's really expected. And also, I would need a supervisor. So is that something you would offer?
Yes.
For accreditation, if you need a supervisor?
I do, definitely. I am, you know, I love supervision. You probably could tell, but I do love supervision, and so yes, I do try and, you know, definitely keep a few spaces open, even more so than patients, because I see a lot of patients, but I like the career development and the clinical supervision and the consultancy side of things. So yes,
I feel you about that. All right.
Yes.
Yeah, thanks guys.
Okay, thank you, Anne-Marie. Lovely to see you.
Thank you so much, Moya. It's really helpful.
Oh, good.
It's very helpful, actually. Yeah, just
brilliant.
Organises my mind a bit.
Good. That's what I wanted. You know,
yeah.
You went away with a clearer idea rather than the right answer, if that makes sense.
No, it definitely does help a lot. Thank you so much. Thank you.
Oh, thank you. Cheers, Hina. Bye.
Sorry, can I just ask before we go, regards to obviously that's the KSA, and on 14 where we're going through our biography,
right, yeah,
would you expect more of like a CV approach, or would you expect more of
narrative? Would you expect that is your chance to just tell your story, really? Some people do it that way with bullet points, but I just think it's a missed opportunity for you to come to life, if that makes sense, Fern.
And would you recommend it? Obviously, everything throughout it's going to be sort of formal anyway, but I have the habit of doing quite an informal approach, and sometimes
that's nice. It's your opportunity to add that bit, that personal touch. So I always love the storied, narratives of a person's career. It's your journey, and we just want that to come to life. So, and that's a lot nicer when you do it in that kind of informal way, isn't it?
Yeah, brilliant. Thank you very much for that, though.
That's all right. Thank you for coming. I appreciate it.
I'm already halfway through, so I'm pretty sure I'm going to have to go back and redo quite a few things, but hey ho.
Oh, well, no, nothing's wasted, remember. That was just like the first thoughts that you had, and you're just going to shape them up. That's all.
Yeah. But thank you very much for that.
You're welcome. Thanks for coming. Cheers, Fern. Right, has anybody else got any questions? Because like I say, I appreciate I'm sort of like now, eating into your evening even more. But like I say, I'm happy to answer any more, or or you can send me a message or join the Facebook group.
I have one question just regarding evidence.
Okay.
So we've got a lot of, so we do these statements, but we've also got to evidence our learning.
Yeah.
So we can put any previous qualifications that we've got. But if we're coming from like a non-traditional route where we don't necessarily have like undergrad in psychology or something like that, what would you suggest using as evidence to back up?
I would say that for those kinds of issues and questions, the guidelines are quite good, because they do kind of give you a list of kind of suggested forms of evidence. So, personal study counts. So if you've, done, and I think they put it in terms of how many hours you do. So let's say you spend you do an online course or something, and it's got some tasks involved, and in total it comes to 10 hours of study or something. Then demonstrate that in not only what you did but what you learned from it. So I think they say to do a reflective account of that learning, and that's your evidence then, isn't it, of how useful that training or that reading or personal study was, and how it relates to the particular criteria.
Okay, no, that's perfect. That's brilliant. Thank you.
You're welcome.
Thanks.